Breaking news for every Social Security, SSI, and SSDI recipient in America. There is a deadline coming on April 30th, and millions of people have no idea it exists. If you receive Social Security retirement benefits, if you're on SSI or SSDI, or if you depend on Medicare for your health coverage, this video is not something you can afford to skip, because what happens before April 30th could determine whether you keep receiving the money and the coverage you have been counting on every single month. We're talking about thousands of dollars in benefits. We're talking about your Medicare coverage. We're talking about your financial stability, and for some people, your ability to pay rent, buy groceries, and cover your medications. This is not a scare tactic. This is not clickbait. These are real changes happening right now in 2025, and the federal government is not going to knock on your door and remind you. That is why we are here. Stay with us for the next few minutes. What you learn in this video could protect your income and your health coverage for the rest of this year and beyond. Do not turn this off. Do not skip ahead. Every single part of this update matters. Welcome back, everyone. And if this is your first time here, welcome. This channel exists for one reason and one reason only: to protect you. To make sure that the millions of Americans who depend on Social Security, SSI, SSDI, and Medicare are never left in the dark about the decisions, the deadlines, and the rule changes that can take money out of their pockets or coverage away from their doctors. We know how confusing government programs can be. We know that Social Security Administration notices arrive in envelopes that look like junk mail. We know that Medicare rules change every year and nobody explains them clearly. We know that you are busy, you may be dealing with health challenges, and the last thing you need is to miss a deadline because nobody told you about it. Every week, we break down the updates, changes, deadlines, and payment schedules that matter most to you in plain English, no confusing government language, no fine print. If you have not already subscribed, please do that right now. Tap the subscribe button and turn on notifications. It is completely free, and it means you will never miss an alert like this one again, because these deadlines and updates happen throughout the year, and staying informed is how you stay protected. Now let's talk about what is happening before April 30th and why it matters so much. The April 30th deadline. What is really happening? Let's start at the beginning because you deserve the full picture. Right now in 2025, there are several major intersecting issues that are converging around the April 30th date. And together, they create a situation where millions of Social Security, SSI, SSDI, and Medicare recipients could lose thousands of dollars or have their coverage disrupted. We are going to walk through each one clearly. Here is something many people do not know. The Social Security Administration, the agency that manages your benefits, has been dealing with a serious staffing crisis. Field offices across the country have reduced hours, reduced staff, and in some cases, temporary closures or service delays. What does that mean for you? It means that if you have a pending review, a benefit verification, an appeal, a name change, a direct deposit update, or any kind of action that requires a human being at SSA to process your request, those actions are taking significantly longer than they used to. And here is where April 30th becomes critical. The SSA has notified recipients that certain pending account reviews and eligibility redeterminations must be resolved by the end of April. If those reviews are not completed, if documents are not submitted, if phone appointments are not kept, if mail from SSA is ignored, benefits can be paused or stopped entirely. Let me say that again. Benefits can be paused or stopped entirely. This is not a minor delay. This is not an inconvenience. For a senior living on a fixed income, losing even 1 month of Social Security could mean choosing between medication and groceries. For a person on SSI, it could mean being unable to pay rent. Now, who does this affect? It affects people who have received a letter from SSA asking them to confirm their address, their income, their living situation, or their identity. It affects people who have recently moved and did not update their address with SSA. It affects people who have had changes in their household, a spouse passing away, a child leaving the home, a change in income. And it affects people who have open appeals or prior benefit suspensions that were never fully resolved. If any of that sounds like you or someone you love, pay very close attention to the rest of this video. Now let's talk about Medicare, because this is where things get extremely important for millions of Americans. Medicare has specific enrollment windows. These are periods of time where you can sign up, make changes, or correct coverage gaps. Outside of those windows, you generally cannot make changes, and you may face financial penalties for missing them. There is a special Medicare enrollment window that closes April 30th, 2025. This applies specifically to people who, one, aged into Medicare eligibility at 65 but delayed enrollment because they had employer-sponsored health insurance. If that employer coverage has recently ended or will end soon, you have a limited window, a special enrollment period, to sign up for Medicare Part B and Part D without facing a late penalty. 2. People who were on Medicaid and are transitioning off due to income changes or the end of Medicaid continuous coverage rules. This population, often lower-income seniors and people with disabilities, may now need to enroll in Medicare or switch plans before losing coverage. 3. People who experienced what's called a qualifying life event, moving to a new area, losing other health coverage, or a change in household status, may qualify for a special enrollment period through April 30th. Here is why this matters so much financially. If you miss the special enrollment period for Medicare Part B, you will face a late enrollment penalty of 10% for every 12-month period you were eligible but did not sign up. That penalty is permanent. It stays on your premium for life. For Medicare Part D, the prescription drug coverage, the penalty is 1% of the national base premium for every month you were without coverage. Again, permanent. Again, for life. We are talking about penalties that can add up to hundreds of dollars per year, every year, for the rest of your life. Over a decade, that is thousands of dollars in avoidable costs. And the cruel thing about this system is that it is easy to miss. Nobody sends you a flashing red notice. Nobody calls you on the phone. The window opens, and it closes, and the penalty clock starts ticking. That is why you need to act before April 30th. Let's talk about a real example so this feels concrete. Meet Margaret. She is 67 years old and has been living in Texas. For the past 3 years, she was covered by her husband's employer health plan. Her husband retired in March 2025, and that employer coverage ended. Margaret now has 8 months from the date her husband's employment ended to enroll in Medicare Part B without a penalty, but she doesn't know that. She thinks she can wait until the fall to figure it out. She misses the window. Now she owes a permanent 10% premium penalty for the rest of her life. Don't be Margaret. Check your dates. Take action before April 30th. This one hits people who have recently had higher income, and they don't even realize it's coming. IRMA stands for Income-Related Monthly Adjustment Amount. It is a surcharge on Medicare Part B and Part D premiums for people whose income exceeds certain thresholds. Here is the trap. Medicare uses your tax return from 2 years ago to determine your IRMA surcharge for the current year. So in 2025, Medicare is looking at your 2023 tax return. If you had unusually high income in 2023 from the sale of a home, a large withdrawal from a retirement account, a one-time distribution, or any other income event, you may be seeing a significantly higher Medicare premium in 2025 than you expected. The standard Medicare Part B premium in 2025 is $185 per month. But with IRMA, depending on your income level, that premium can jump to $250 per month, $370 per month, or even higher. That can be a shock of $74 to $185 per month or more on top of what you expected to pay. Now, here's the critical part. If your income has dropped since 2023, if you retired, if that one-time event was truly a one-time thing, if you have had a life-changing event, you can appeal the IRMA surcharge. You do this by filing a life-changing event form with Medicare, specifically Form SSA 44. And you need to do it before April 30th if you want it applied to your 2025 premiums. This is money back in your pocket. Real money, hundreds of dollars per year. But you have to act before the deadline. Many SSI and SSDI recipients also receive SNAP benefits, what used to be called food stamps. SNAP requires periodic recertification to confirm you are still eligible. These recertification deadlines are easy to miss because the notice comes separately from SSA through your state's benefits office. Many states set April 30th as a recertification deadline for SNAP recipients who certified in late 2024. If you miss the SNAP recertification deadline, your food assistance stops immediately, and reinstating it can take weeks, leaving a gap in assistance that many families cannot absorb. Now, here is the added complexity. For SSI recipients specifically, if your SSI benefits were adjusted or suspended at any point during 2024 or early 2025, that change may have been flagged by your state's SNAP office as a potential eligibility issue. That means you may be required to recertify sooner than your normal cycle. Check your mail from your state benefits office. Call your local SNAP office. Do not assume your SNAP benefits will just continue on their own. In January 2025, Social Security recipients received a 2.5% cost of living adjustment, a COLA increase. For most people, that was reflected automatically in their January payment. But here is the issue. Not everyone has seen the correct amount hit their bank account. People who have garnishments on their Social Security for student loan debt, for overpayments being recovered for certain tax debts, may have seen their COLA increase partially or fully absorbed by those deductions. People who have recently become eligible for Medicare and had premiums automatically deducted from their Social Security may be receiving less than they expected if the Medicare premium increased at the same time the COLA was applied. And people who recently went through a benefit adjustment, a change in their benefit type, a switch from SSDI to retirement benefits at full retirement age, or a survivor benefit calculation may not have had the COLA correctly applied. The April 30th relevance here is this. If you have not verified that your 2025 payment amounts are correct, if you have not checked your My Social Security account online or called SSA to confirm, you may be receiving the wrong amount and not even know it. SSA has error correction windows, but they are limited, and overpayments and underpayments are much easier to correct when caught early. Check your account, check your payment amount. Do it now. Okay, we have covered a lot of ground. Let's slow down for a moment and make this very practical. Here is exactly what you need to do step by step before April 30th. If you have a stack of envelopes you haven't opened, open them today. Any letter from the Social Security Administration or from Medicare should be treated as urgent. These agencies communicate almost entirely by mail. A letter asking for a response, a document, or a scheduled phone call may have a deadline that is weeks away or days away. If you have moved recently, call SSA at 1-800-772-1213 to make sure your address is updated. You cannot afford to have important notices going to an old address. Go to ssa.gov and create or log into your My Social Security account. This is a free online account that lets you see your payment history, your current benefit amount, any pending reviews or notices on your account, and your Social Security statement. If you see any alerts, notices, or requests for information, address them immediately. If you cannot access the online account because you don't have a computer or you're not comfortable online, call SSA directly at 1-800-772-1213. They can read you any notices on your account over the phone. Log into your Medicare.gov account or call 1-800-MEDICARE. That is 1-800-633-4227. Confirm what plan you are enrolled in, what your current premium is, and whether your coverage is active. If you believe you had a qualifying life event that should allow you to change or enroll in a Medicare plan, call Medicare now. Don't wait. The April 30th window for certain special enrollment periods is closing. If you received an RMA surcharge and your income has decreased since 2023, visit ssa.gov or your local Social Security office to file Form SSA 44 to appeal it. Call your state's SNAP benefits office or log into your state's benefits portal. Ask specifically, when is my next SNAP recertification date? Is there anything I need to submit to keep my benefits active? Don't assume everything is fine. Take 30 minutes to verify. It could save you weeks of lost food assistance, even if you do everything right, even if you submit every document and make every phone call. The current backlog at SSA means processing can take time. During that time, it is possible that a payment may be delayed. We strongly encourage you to set aside a small cushion, if at all possible, even $100 or $200 in a separate account, to bridge any unexpected gap in benefits. We know that is easier said than done on a fixed income, but even a small buffer can prevent a bad situation from becoming a crisis. Talk to your family members. Let them know what is happening. If you have adult children or trusted friends who can help you navigate the phone calls and the paperwork, ask for that help. There is no shame in it. These systems are complicated on purpose. Getting help is smart. Before you hang up from any call with SSA or Medicare, write down the date and time of the call, the name of the representative you spoke with, and any confirmation number they give you. This is your paper trail. If there is ever a dispute about whether you responded to a notice or submitted information, that paper trail is your protection. We will be tracking what happens around April 30th and updating you on any extensions, any SSA announcements, and any follow-up actions that may be needed. Subscribe now so you don't miss those updates. Before we wrap up, I want to say something directly to you. What we do on this channel, breaking down Social Security updates, Medicare changes, SSI and SSDI news, this is not just content. It is a service. Because we know that for most of the people watching, this money is not discretionary. It is not extra. It is everything. It pays your rent or your mortgage. It covers your prescriptions. It puts food on your table. It keeps the lights on. And the people who run these programs, as well-intentioned as many of them are, do not always communicate changes in a way that is easy to understand or in a way that gives you enough time to prepare. So if this video helped you, if it gave you clarity, if it made you feel less alone, if it gave you a specific action step that could protect your benefits, please share it. Share it with your neighbor who is on Social Security. Share it with your parent who is turning 65 this year. Share it with the person at your church or community center who is struggling to understand their Medicare bill. You sharing this video is how we reach the people who need it most. The people who don't know to look for this information, who don't have someone helping them navigate the system. And please, if you haven't already, subscribe to this channel and turn on notifications. It takes 5 seconds. It costs you nothing. And it means that every time a deadline like April 30th is approaching, you will be one of the first to know. We cover Social Security payment dates. We cover COLA updates. We cover SSI and SSDI eligibility changes. We cover Medicare open enrollment. We cover everything that touches your financial security as a senior or as a person with a disability. Leave a comment below and let us know. Did you know about the April 30th deadline before watching this video, or did we catch you just in time? We read every single comment. Your stories help us know what to cover next, and sometimes your comment is the thing that helps another viewer realize they need to take action too.